Well, first, I would not call the DACA recipients, the unaccompanied minors, apprehensions. The vast majority of the unaccompanied minors are walking across and saying, help us, please. I think apprehension is a weird word to use.
Well, that's precisely my point, though. They can just walk in and turn themselves in.
The second point I'd make is DACA was wiped off the books by this administration in March of this year. And since March, the number of people coming across the border has increased, not decreased. So DACA is gone. It is no longer the law. And we went from having 36,000 people apprehended at the border in February to 50,000 in March, and then almost to 51,000 in April. So if DACA was the magic thing that is causing this, it seems to me we'd see, and by the way, DACA doesn't even apply to these kids. None of them are qualified for DACA, none of them. So I think we've got problems securing our borders, and I don't want to argue about that because I think we all agree that we have to secure our borders. I want to focus in on this, once again in your opening statement, you talked about the drugs at the southern border. 90% of the opioids that are being seized at the ports of entry, correct, Secretary Nielsen?
I don't have that exact figure, but yes, the majority.
We do. We got it from you.
The majority of drugs that we see are coming through the ports of
entry. Like 90%. 85% of the fentanyl, which is killing all of our constituents every day, 85% of it is coming in through the ports, not across the southern border. So whenever this talking point that it's the people coming across the southern border that are bringing all the drugs, it's like fingernails on a blackboard because it's just not accurate. And here's the thing I don't get. There has been 0 requests for additional port officers, 0, last year or this year, to be used at these critical places. You did ask for 60 this year, but it was all for a training center, not for actually deployment into these ports. And according to your own staffing studies, you are short by over 4,000 officers at these ports. Our citizens are dying from fentanyl every day. Our emergency rooms are overloaded. There isn't a week that goes by that I don't talk to a parent in Missouri who has lost a child to fentanyl overdose that's coming in this manner. Can you explain why we're continuing to ask for more agents along the border when we can't hire enough, but there's no requests for this critical need in our country?
Yes, Senator, first I'd just like to say it is a huge problem. It's one, as you know, that we take seriously, the full administration. Let me give you a short answer and a long answer. The short answer is it's not just the people at the ports. So what we have done is we've asked for additional technology. As you know, we have now trained canines at every port of entry to actually find the drugs. What we find is far and away, the best way to detect the drugs coming through the ports is through that non-intrusive technology and through canines. So we have increased that, and we continue to ask for additional resources. What we've also done, though, is taken the approach to try to push the borders out. So rather than waiting for the drugs to come here, we're working much more in a forward deployed fashion through JTTFs, through what we have in Key West, which, as you know, JIDF South is a multi-20, 30 country effort to identify and track the drugs before they ever reach our shores, before they ever reach the ports of entry. We also, you mentioned in your opening remarks, the vast increase in mail. We thank you for the Interdict Act. We're working with you on the STOP Act. We need to do more there, absolutely, because that's the other way that fentanyl is getting in. So we're trying to look at it as a system of systems. In other words, what are all the different interdiction points that we can best get after this? Another one we have asked for budget on are our cyber capabilities within ICE and Secret Service, because most of these drugs in marketplaces are on the dark web. So we've increased our capability to take them down, to track the TCOs to their source, and to turn off not only their market, but their ability to get the drugs. So yes, we have to continue to do more, but we're trying to do it in a layered approach, so it's a system approach.
Is there a good answer as to why there was 0 requests for additional port officers when you are 4,000 staff members under your staffing model? And yet there were 750 additional agents requested along the southern border, even though you can't even fill or the attrition that you're having now? Is there a good reason as to why there would be that dichotomy?
The good news I'll mention quickly is that the attrition's down, and we can talk more about hiring because I know that was a concern of yours in general. But happy to come in myself or have folks come and walk you through the model. The other part about drugs that I didn't mention is what we tend to see is the drugs themselves will be smuggled through the ports of entry. Again, we use the technology and canines, but the people, the actual TCO members who will then sell the drugs, come in between the ports of entry because they know if they come in at the port of entry, they'll be stopped. So it's we need to stop the people and the drugs. But in terms of the staffing model that you're discussing, I'm happy to come talk to you about it in detail.
Yeah, it doesn't, and if you look at your staffing at the United States in terms of mail facilities, it's even worse. I mean, you've got 17 officers covering 2 shifts in Cincinnati, screening almost 46 million import shipments in 1 year. I mean, that's just overwhelming. I just think somebody has got to get off the political speeches problem and be pragmatic. All of us want to support what you need along the border. But this notion that if we can just say, look over here, it's all about people coming across the border and totally ignore the biggest public health crisis this country has ever faced by not adequately staffing the places where the drugs are coming in is just heartbreaking to me.
But ma'am, I'm not saying that. What I'm suggesting is that what we find is the best way to identify those drugs is through technology and canines, and that's what we're increasing.
But you have to have people to run both technology and canines.
We have to have
Every
people.
dog has a handler.
We have to have
in
people
fact,
as well.
more than one handler.
But there's no suggestion that we have a lack of people to work with the canines or run the machines. So again, happy to walk you through, but I do want to make clear we're attacking the opioid crisis from many, many levels with many capabilities.
I have questions about the air marshals, but I will hold those until the next round. Thank you, Secretary. I just wanted to clarify something. There was, the chairman wanted to equate the process by which children are separated from their parents to a similar process when someone is arrested in, let's just take a community where I was the elected prosecutor for years. When a child is left without a parent because of breaking the law in the state system, the police hand it over to the social service agency, who then has primary responsibility ongoing through social workers, placement, a child abuse hotline. They are always in contact with the state authorities until there is some kind of permanency to their legal situation. Let's compare and contrast what happens with DHS. DHS keeps the children for maybe 48 hours, hands off to HHS. HHS then tries to put them somewhere. And very, very, very few even household visits for sponsors. And then they're done after they find a sponsor. There is no handing off to the state social service agencies. That's why nobody's showing up for the hearing, Secretary. It's because it's not like the state system. I can assure you that if a child was supposed to show up somewhere that was in a state's care, phone would ring, or the child abuse hotline would ring, or a teacher would be required to call in. That's not happening with these kids. That's why they're not coming to court. Nobody's paying any attention. So I just couldn't let it pass that we were equating those two systems, because having a great deal of experience in one of them, having handled child abuse cases for a number of years, nothing is further than the truth. And there is still not a joint concept of operations, which was promised to Senator Portman and I at a hearing in 2016 as to how we're going to alleviate this problem. So once you start taking these children, please, I don't think any record should reflect that somehow you are confident, or anybody is confident, that they're being placed in a safe and secure environment and being appropriately managed, because frankly, if they were, they'd come to their hearings.
So could I just respond to that? Sure. I think the comparison I was trying to make was in the separation of families. It's not something unique we do with illegal aliens when someone has broken the law.
You have to separate children from families when there's been a violation.
Yes, ma'am. But having said that, I just want to say I couldn't agree with your concerns more, period. We are working with HHS. We've done this MOA. I will look into the CONOPS. I do know that we've revised it because we now, in conjunction with HHS, are requiring various checks be made to ensure that the sponsor truly does have a custodial relationship and is not a trafficker or an abuser. And as you know, we've had terrible instances of that occurring. It's not acceptable. It's not acceptable.
You know, the fact that there isn't a CONOPS, the fact that there is no joint concept of operations, and we are upping the number of children we're taking from families is outrageous.
So there is a CONOPS. What I'm suggesting is yeah, and I appreciate that, and we'll get it to you. We're updating it because we now have this MOA with HHS that requires both of us to share information so that we can vet the sponsor who appears to take the child, especially when that sponsor is not a parent. So this is why we just signed this MOA. I couldn't agree more. We have to do more.
And of course, I would completely agree the state's going to be better than the federal government at just about anything it does. And the point I was making in terms of DACA, I mean, I completely understand that that does not apply to current arrivals, but they don't know that. That DACA was used as a spark. They were told once they get there, they can stay. And by the way, they have. 96.5% of unaccompanied children from Central America have stayed. They use social media. That's communicated down to Central America, and more come. So it's that flood into a federal system that has created the crisis. So again, the goal of policy ought to be to reduce the flow like Secretary Chertoff did in Brazil. Senator Heinkamp.